Welcome, everyone, to the deep dive. It is so great to have you here with us today.
Yeah, really glad you could join us.
If you are joining us, it is probably because you are, that kind of curious learner who really wants to cut through the absolute noise of medical information overload.
And there is a lot of noise out there.
Oh, an incredible amount. We are all subjected to it on a daily basis. You know exactly what I mean. You go online to look up a simple question about a treatment or a symptom, and suddenly
You have 50 different browser tabs open.
exactly, 50 tabs. You've
Right.
got conflicting medical advice on one screen, forums filled with confusing, hyper-specific jargon on another.
Right.
And by the end of it, you feel more lost than when you started. It can be incredibly overwhelming and, frankly, a little anxiety-inducing.
I mean, it is essentially a full-time job trying to parse through it all.
It really is. So our goal today is to do the heavy lifting for you. We take the source material, we break it down, and we figure out what is actually important, what it means for you, and how it fits into the broader landscape of health and medicine.
And the material we are working with today provides a perfect lens for that exact problem.
It really does.
We are looking at a comprehensive medical and patient safety profile from an independent medical information platform called iMedix.
For those who might not be familiar with it, iMedix is a really interesting corner of the internet.
Yeah, it operates essentially as a massive drug database, but it pairs that raw data with educational resources and a very strong focus on patient safety discourse.
They don't just list the chemical name and the dosage.
No, they explore the medications, they detail the safety warnings, and try to contextualize treatment topics. The whole goal is to help readers actually understand the health data they are looking at.
Rather than just blindly following it.
Exactly.
And the specific focal point of today's deep dive, the subject we are pulling directly from their database, is a highly searched, multifaceted medication called Nizagara. Now, whether you are intimately familiar with the landscape of pharmacology or you just casually glance at medical news, this is a topic that touches on some of the most fascinating aspects of modern healthcare.
To set the stage properly, we really need to define exactly what we are looking at here, because the categorization on the platform is everything.
Oh, absolutely.
On the platform, Nizagara sits in a very specific, very distinct category. It is clearly and explicitly listed as a non-FDA approved generic.
A non-FDA approved generic.
Yes. Furthermore, the database notes that it is manufactured by a company called Orochem Laboratories, Ltd.
Right.
Right out of the gate, that categorization makes this a deeply fascinating case study. We aren't just looking at a standard, heavily marketed prescription that you pick up at your local brightly lit corner pharmacy.
We are looking at something that exists in a much more complex space.
Exactly.
Which brings us to the ultimate question. Why should you care? Why spend our time unpacking the profile of a non-FDA approved generic?
It is a fair question.
Well, because whether you are actively researching treatment options or you are simply interested in the intricate science of how drugs are formulated.
Or maybe you are completely fascinated by the gray areas of global healthcare.
Yeah, the massive rise of online pharmacies. This deep dive is going to explore how a single blue oblong pill sits squarely at the intersection of all these massive topics.
It is a window into how modern patients navigate their own healthcare in a digital age.
Often driven by desperation, cost, and a desire for alternative solutions. Okay, let's unpack this.
The most logical place to start is right at the chemical foundation. What is actually happening at the cellular level?
The engine under the hood, so to speak.
Right. The active ingredient in Nizagara 100 milligram tablets is sildenafil citrate.
Sildenafil citrate. Now, that name is an absolute heavyweight in the pharmaceutical world.
Oh, definitely.
It is the exact same active ingredient found in the incredibly famous blue pill, Viagra. We are talking about the exact same chemical engine here.
It is the blockbuster chemical that completely revolutionized men's health back in the late 90s.
Precisely. It is a known, thoroughly studied entity. But to understand how a drug like Nizagara works, we need to understand the fundamental mechanism of action of sildenafil itself.
It works as what is known as a phosphodiesterase type 5 inhibitor.
Usually you'll just hear it referred to as a PDE5 inhibitor.
Right.
So if PDE5 is an inhibitor, I'm guessing it acts like a biological stop sign for blood flow. Is sildenafil basically just running that stop sign?
That's a great way to start looking at it. The primary goal of the medication in this context is to treat erectile dysfunction.
Okay.
To achieve that, the human body needs to relax the smooth muscles in the penis to allow for a massive increase in blood flow.
And the body does this naturally, right?
Yes, by producing a chemical called nitric oxide. Nitric oxide is the crucial chemical messenger. It's the signal that tells the blood vessels to relax, to widen, and to let the blood rush in.
Right, so nitric oxide is the green light.
Exactly. But the body is all about balance. It can't just leave that green light on permanently, or you'd have serious physiological problems.
Oh yeah, massive blood pressure drops, I would
It's
assume.
exactly. So the body also produces that enzyme we just mentioned, PDE5. You can think of PDE5 as the enzyme that breaks down the nitric oxide signal.
So it's the cleanup crew.
It's the biological cleanup crew that eventually tells the blood vessels, okay, we're done here, time to constrict again and return to normal.
Okay, I follow.
What sildenafil citrate does is inhibit or block that PDE5 cleanup crew. By temporarily disabling the enzyme that causes the blood vessels to constrict, it massively enhances and prolongs the effects of the nitric oxide that is already there.
I think we can build a really clear visual out of this for the listener. Imagine a massive, multi-lane highway leading into a city.
Okay, I picture it.
The nitric oxide is the signal to open up all the lanes, lift the toll boom gates, and let the traffic, the blood flow, surge through completely unobstructed.
I like that. And in that scenario, the PDE5 enzyme would be a rogue construction crew.
Exactly. A rogue construction crew that constantly wants to throw up orange cones, close down lanes, and force all that fast-moving traffic into a slow, single-file line.
Right.
When you take a PDE5 inhibitor, like sildenafil, you are essentially sending in the highway patrol to halt the construction workers.
You stop them from putting up the roadblocks.
The drug doesn't create the cars on the highway. It just guarantees that the lanes stay wide open so the traffic can flow freely.
It's an elegant mechanism, but that highway analogy brings us to a crucial and very frequently misunderstood caveat to this entire process.
The psychological element.
Yes, and this is a vital piece of patient education that the data heavily emphasizes. Sildenafil does not increase sexual desire on its own.
This is such a pervasive misconception. People often think of these medications as aphrodisiacs.
Like they are some kind of magic switch that just turns on arousal instantly.
But the effectiveness depends entirely on sexual stimulation. It absolutely does not cause sexual desire independently.
But the why behind that is purely physiological.
Yeah.
Going back to your highway analogy.
The drug keeps the lanes open, but it doesn't put the cars on the road.
Beautifully said. Sildenafil strictly facilitates the mechanical process of blood flow. It is, for lack of a better term, a drug that manages the plumbing.
Right.
But the psychological and neurological trigger of sexual arousal, the complex cascade of signals from the brain that tell the body to release that initial burst of nitric oxide in the first place, that is still entirely required.
So if you aren't aroused, your brain never sends the nitric oxide signal.
Correct.
And if there's no nitric oxide signal, there's nothing for the drug to enhance. You could take the pill and absolutely nothing would happen if the neurological spark isn't there.
Precisely. If there is no sexual arousal, the PDE5 inhibitor has nothing to work with.
Wow.
Furthermore, after sexual activity, as the neurological arousal naturally fades, the brain stops sending the nitric oxide signal.
Okay.
Once that initial signal stops, the penis will naturally return to its non-erect state, even if the drug is still in your system, because the underlying trigger is gone.
It makes total sense when you break down the actual biology. It is a facilitator of a process, not the initiator of the process.
Exactly.
Now, looking at who this medication is actually designed for, the profile cites clinical studies regarding the demographics of the patients taking it.
Yes, the age ranges are quite broad.
The data notes that the drug is generally safe, with a relatively low incidence of severe health impacts in men ranging all the way from 19 to 85 years old.
What's fascinating here is what the data suggests about that incredibly wide age range.
Which is?
The occurrence of side effects does not appear to be significantly related to age. This means that age alone may not strictly dictate or require an automatic dosage adjustment.
That is genuinely surprising because we are so conditioned to assume that as we get older, our bodies become universally more fragile.
Right.
And we assume that dosages of heavy-duty medications need to be aggressively dialed back just as a blanket rule.
But the clinical data suggests that the calendar year you were born isn't the sole determining factor for how your body will react to the drug.
It isn't the sole factor, but the profile does provide a highly specific and important nuance for the older demographic.
It does. It mentions that while men over 65 can absolutely take this safely, they are often advised to start with a lower dose, usually 25 milligrams instead of the standard 100 milligrams.
But the reasoning isn't because an older heart or older blood vessels are inherently guaranteed to have a bad reaction.
No, the reasoning is tied entirely to metabolic processing.
The liver and the kidneys.
Exactly. As the human body ages, its internal filtration systems, primarily the liver, which breaks drugs down, and the kidneys, which clear them out, begin to slow down.
It makes sense.
A slower metabolism means the drug isn't cleared from the bloodstream as quickly as it would be in a 25-year-old.
So the drug stays in the older patient's system longer.
And at higher concentrations, which naturally leads to an increased sensitivity to its effects.
So while age alone doesn't guarantee a severe adverse event, the changing speed of an older metabolism warrants a much more cautious starting point.
You don't want a standard dose acting like a double dose simply because the liver is taking its time processing it.
Right. So we have this core engine sildenafil citrate. It's managing the blood flow. It's working as a PDE5 inhibitor to keep the highway open.
Yes.
It relies heavily on the psychological spark of arousal, and it spans a massive age range of efficacy, provided we respect the metabolism of the patient.
That covers the core pharmaceutical aspect.
If that were the end of the story, Nizagara would just be another standard, run-of-the-mill generic copy of Viagra sitting in a massive database. But here's where it gets really interesting.
It absolutely does take a very unexpected turn here.
Because Nizagara is not just sildenafil. Unlike its famous pharmaceutical counterparts that you would get prescribed at a standard clinic,
Right.
this specific non-FDA approved generic contains a whole proprietary blend of vitamins and supplements mixed right into the tablet alongside the heavy-duty pharmaceutical.
The profile explicitly calls this a comprehensive approach to treatment.
And I think we need to meticulously go through this ingredient breakdown because this kitchen sink approach is what makes this specific drug such a fascinating study in modern medical marketing.
It is a brilliant, if highly debated, formulation choice by the manufacturer. They have essentially created a pharmaceutical hybrid.
A hybrid.
They took a proven clinical chemical and wrapped it in the language and ingredients of the supplement industry. Let's look at the physiological claims for each of these added ingredients as they are presented in the data.
Okay, let's start with the first major addition alongside the sildenafil. It lists L-arginine.
L-arginine.
Now, if you've ever stepped foot in a sports nutrition store, you've seen huge tubs of this stuff. The profile describes this as an amino acid.
Which it is.
It claims that L-arginine improves blood circulation, reduces the risk of heart disease, and enhances sperm production.
It also specifically notes that it helps create conditions favorable for longer erections.
Right. From a purely biochemical standpoint, does adding L-arginine make sense?
It actually makes a lot of logical sense when you are designing a vasodilatory drug. L-arginine is a direct biological precursor to nitric oxide in the human body.
Oh, really?
Yes. The body literally uses L-arginine as the raw building material to manufacture nitric oxide.
Wow. So it's a two-pronged attack on the exact same problem.
Exactly. While the sildenafil is acting as the inhibitor stopping the enzyme that breaks down nitric oxide, the L-arginine is theoretically providing the body with a massive influx of the raw material needed to produce more nitric oxide in the first place.
It's attempting to maximize the green light while simultaneously arresting the construction crew.
That is the goal, yes.
Yeah.
Next on their formulation list is something called red berry extract.
Red berry extract. See, this is where it starts to sound a bit more like something you'd find in a high-end smoothie rather than a pharmaceutical blister pack.
It does sound like that.
The profile states it is known for its revitalizing properties and that it boosts immune system function and improves vascular tone.
Vascular tone is the critical phrase there. It sounds like marketing speak, but it has a real physiological meaning.
How so?
Think of vascular tone like the tension on a rubber band. If a blood vessel is too tight or hyperconstricted, blood struggles to get through.
Okay.
If it's completely flaccid and lacks any tone, it can't efficiently pump blood back to the heart. Vascular tone is the degree of constriction experienced by a blood vessel relative to its maximally dilated state.
So it's about the health of the vessel itself.
Right. By including an extract that claims to improve vascular tone, the formulation is attempting to target the overall health, elasticity, and responsiveness of the circulatory system.
They aren't just trying to force the vessel open for a few hours.
No, they are claiming to improve the actual physical health of the vessel wall.
Which, again, plays right into that comprehensive angle. Then we move away from the plant extracts and get into the B vitamins, starting with adermin, which is vitamin B6.
Vitamin B6 is heavily involved in human metabolism. The data highlights that it is crucial for protein synthesis and healthy liver function.
But it also highlights claims that are very specific to the target demographic. It says B6 increases endurance during physical exertion and promotes muscle tissue growth.
And this is exactly where we start to see the formulation pivot sharply.
What do you mean?
It is moving away from purely treating a mechanical vascular issue, erectile dysfunction. And it's beginning to address much broader, highly marketable concepts of male vitality, gym culture, and physical performance,
Ah, I see.
claiming that an ED medication also aids in endurance during physical exertion and muscle tissue growth is a very deliberate choice to appeal to a specific mindset.
It totally is. Following the B6, the profile lists vitamin B12 and folic acid, noting that they work together in the body.
The claims for this duo are incredibly extensive.
The profile states that B12 and folic acid support blood formation and maintain the nervous system.
Yes.
It says they enhance skin regeneration, aid in complex metabolic processes, and contribute to stress reduction.
And it goes even further.
It claims they contribute to maintaining overall male health, reducing heart disease risks, normalizing cholesterol, lowering blood pressure, and even improving brain function.
Right.
I mean, that is a massive, almost unbelievable list of secondary benefits packed into a single pill that you are primarily taking for blood flow.
It is the ultimate kitchen sink approach.
Yeah.
But if we analyze why a manufacturer would create this specific cocktail, it reveals a very distinct, very modern treatment philosophy.
Sure.
By combining a potent, strictly regulated pharmaceutical, like a PDE5 inhibitor, with amino acids, plant extracts, and a full spectrum of daily B vitamins, the manufacturer is attempting to bridge a very specific psychological gap for the consumer.
Bridging a gap.
They are trying to merge traditional clinical intervention with the booming multi-billion-dollar market of holistic men's wellness and biohacking.
That concept of biohacking is so relevant here. I want you, the listener, to really consider how this all-in-one marketing appeals to a specific type of patient. Think about the psychology of it.
Powerful.
Traditional prescription drugs can be incredibly intimidating. They feel clinical, sterile, and let's be honest, they often carry a heavy social stigma.
Especially when you are dealing with something as personal and sensitive as erectile dysfunction.
Right. Going to a doctor, getting a prescription, picking up a little bottle with a sterile white label, it forces a man to admit, I have a medical dysfunction.
It is a confrontation with one's own mortality and physical limitations, which many patients actively avoid.
Exactly. But look at what this formulation does. When a patient reads that this pill doesn't just treat ED, but it also contains vitamins for stress reduction, immune support, muscle growth, and heart health, it entirely changes the narrative.
It absolutely does.
It suddenly feels a lot more like a daily wellness supplement, like a high-end multivitamin, rather than a heavy-duty medical intervention.
The insight here isn't just that vitamin B12 is good for you.
Right.
It's that by wrapping a cardiovascular drug in the sheep's clothing of a daily men's vitality complex, the manufacturer completely bypasses the patient's psychological defense mechanisms.
It turns a clinical admission of dysfunction into a proactive alpha male wellness routine. It softens the barrier to entry.
It's a masterclass in behavioral psychology applied to pharmacology. It frames the drug not just as a reactionary treatment for a singular problem, but as a proactive step toward generalized optimal male health.
However, and this is where the iMedix platform's focus on safety becomes paramount, we have to look critically at these claims.
We absolutely do.
The claims about normalizing cholesterol, improving brain function, and building muscle are incredibly broad.
While the data presents these as the intended benefits of the individual ingredients based on general nutritional science, it is vital to remember that the drug itself is an unapproved generic.
That is a crucial point to keep anchored in our minds.
The actual efficacy of combining these specific vitamins with a heavy dose of sildenafil in this specific binding format hasn't been subjected to the same rigorous, standardized clinical testing as the isolated pharmaceutical would be.
We are reading the manufacturer's intended design, but the reality of how all these various compounds interact once they hit the stomach acid is part of the gray area of this kind of medicine.
It is a massive gray area.
But even if we strip away the vitamins and just look at the core engine, the sildenafil, the data reveals some fascinating, well-documented medical applications that go far beyond what we typically associate it with.
This drug is fundamentally about vascular plumbing throughout the entire human body, not just in one specific area.
Right.
If we connect this to the bigger picture, it completely changes how you view the medication. It is not just a lifestyle drug to improve sexual performance.
It has serious, critical, and sometimes life-saving applications in the realm of cardiovascular medicine.
Let's shift our focus there beyond the bedroom to the broader medical picture.
Because the most prominent off-label or secondary use detailed in the profile is for a condition called pulmonary arterial hypertension.
Commonly known as PAH.
The data describes PAH as a condition characterized by dangerously high blood pressure, specifically in the arteries of the lungs. How does the exact same pill that treats ED help with the life-threatening pressure buildup in the lungs?
It all comes back to that core cellular mechanism of action we outlined at the beginning, the systemic vasodilatory effects.
Okay.
In a patient suffering from pulmonary arterial hypertension, the small, intricate blood vessels within the lungs become abnormally narrowed, blocked, or in severe cases, destroyed.
And the lungs are supposed to be a low-pressure system, right?
They are.
Yeah.
But when those vessels narrow, it becomes incredibly hard for the blood to flow through them to get oxygenated. This creates a massive traffic jam, which drastically raises the blood pressure within the pulmonary arteries.
And the heart is the pump trying to push through that jam.
Exactly. The right side of the heart has to work exponentially harder to force blood through those constricted, unyielding lung vessels.
That sounds dangerous.
Over time, that constant immense strain causes the heart muscle to weaken and fail, which is often fatal.
Oh.
Now, when a patient with PAH takes sildenafil, the drug enters the bloodstream and does exactly what it does elsewhere in the body.
It seeks out and inhibits the PDE5 enzyme.
Right. The PDE5 enzyme is heavily present in the smooth muscle of the pulmonary arteries. By inhibiting it, the drug allows those smooth muscles in the lungs to relax and widen.
It's the highway analogy again. It's lifting the toll gates on the roads leading directly into the lungs.
Yes. And that specific, targeted relaxation relieves the dangerous pressure back up,
It immediately makes it easier for the right side of the heart to pump blood.
which drastically improves the patient's ability to breathe, their ability to exercise, and their overall lifespan.
It takes a drug famous for lifestyle enhancement and turns it into a critical cardiovascular lifeline.
It is truly remarkable.
That is just incredible to think that the exact same cellular action can have such vastly different real-world applications. And the profile mentions another condition too, something called Raynaud's phenomenon.
Raynaud's phenomenon is another brilliant example of how this mechanism can be applied. It is a vascular disorder where the blood vessels in the extremities, most commonly the fingers and the toes, severely overreact to cold temperatures or emotional stress.
It's essentially a massive overreaction of the sympathetic nervous system.
It is.
I've seen photos of this and it looks incredibly painful and disruptive. The fingers literally lose all their color.
You do. During a Raynaud's attack, these small blood vessels in the fingers constrict so dramatically that they essentially clamp shut, cutting off the arterial blood supply.
The affected fingers or toes will often turn stark white, resembling a corpse's hand.
Then, as the tissue is depleted of oxygen, they turn a deep blue or purple.
And then when the blood comes back.
Finally, as the body forces the vessels open again and the blood rushes back in a process called reperfusion, the fingers turn bright red and throb with intense pain.
And the data notes that Nizagara, or rather the sildenafil component, may have potential therapeutic benefits for people suffering from these attacks.
The logic is beautifully simple. The underlying issue in Raynaud's is severe, inappropriate vascular constriction in the extremities.
Right.
The solution provided by the PDE5 inhibitor is systemic vascular relaxation. By taking the medication, it encourages those hyperreactive blood vessels in the fingers and toes to remain dilated.
It provides a chemical buffer.
Exactly. It prevents them from clamping shut when exposed to the cold, thereby preventing the painful attacks and the potential tissue damage that comes from oxygen deprivation.
It is such a profound realization. It shows you that a single chemical key, sildenafil, can unlock very different doors in the human body depending entirely on where the vascular constriction is happening.
It treats the high pressure in the lungs, the hyperreactivity in the extremities, and erectile dysfunction.
All by performing the exact same microscopic cellular task of blocking an enzyme. It really underscores why platforms like iMedix categorize this under broader cardiovascular and vascular health management.
Rather than just pigeonholing it as men's health.
Exactly. The elegance of pharmacology is truly amazing. But we have to pivot here because that exact same power, the ability to systematically dilate blood vessels and fundamentally alter blood pressure across the entire body, is exactly what pushes this medication into what we must consider the danger zone.
It's a very real danger zone.
When you are forcefully altering how blood flows through the intricate plumbing of the human body, there are inevitable, sometimes severe consequences.
And the data does not shy away from this reality. They have extensive, highly detailed sections breaking down the side effects, the weird bodily quirks, and the very severe, potentially fatal risks associated with this drug.
Let's run through the common reactions first, because these are the things that a large percentage of everyday patients might experience just taking a standard dose.
Okay.
The profile lists headaches, facial flushing, stomach upset, and dizziness as the most common side effects.
When you understand the underlying mechanism we've been discussing, every single one of those side effects ceases to be a random mystery and becomes a perfectly logical consequence of the drug's physics.
Let's take the headache.
A headache occurs because the blood vessels in the brain and around the skull are dilating. You are increasing the blood flow and the physical pressure inside the confined space of the cranium, which registers as a throbbing ache.
It's literally just the pipes expanding in your head and the facial flushing.
Same principle. Facial flushing happens because the tiny capillary beds near the surface of the skin in the face, neck, and chest are widening.
Rushing all that blood to the surface.
As they widen, they rush warm, oxygen-rich blood directly to the surface, causing the skin to turn red and feel physically hot to the touch.
And the dizziness makes sense too. If you are opening up all the highways across the entire body simultaneously, the overall pressure in the system has to drop.
Exactly. It's a systemic drop in blood pressure. As the vessels widen everywhere, the pressure drops. If you are sitting down and you stand up quickly, your body might not be able to adjust the pressure fast enough to pump blood against gravity to your brain.
Which makes you feel lightheaded or dizzy.
Even the stomach upset is tied to this smooth muscle relaxation. The drug isn't perfectly localized. It can also slightly relax the smooth muscle of the lower esophageal sphincter.
That's the little valve that keeps stomach acid where it belongs, right?
Yes. If that valve relaxes too much, you get acid reflux or heartburn.
It makes the side effects seem less like your body is malfunctioning and more like it's just obeying the predictable physics of fluid dynamics. You expand the pipes, the internal pressure changes, and you feel the physical result of that change.
That's a great way to summarize it.
But then the data highlights some side effects that are frankly a bit weird. They point out these very specific visual and auditory quirks.
The visual ones are particularly interesting.
The text says some people may experience temporary visual disturbances, such as changes in color perception, increased sensitivity to light, or blurred vision.
Yes, the infamous blue vision effect. It is a well-documented, albeit less common, quirk of PDE5 inhibitors.
And what's the reason for it?
While sildenafil is highly selective, meaning it is chemically designed to specifically seek out and bind to the PDE5 enzyme found in vascular smooth muscle. It is not 100% perfect.
Nothing ever is.
It has a very slight cross-reactivity with a closely related enzyme called PDE6.
Okay, so it accidentally hits the wrong target. Where is PDE6 located?
PDE6 is primarily found in the retina of the eye.
Yeah.
It is an enzyme that is deeply involved in the phototransduction cascade.
Meaning how our eyes process light.
Exactly, how our eyes perceive light and color and transmit that information to the brain. When a high dose of the drug accidentally inhibits a bit of PDE6 along with the intended PDE5, it can temporarily alter how the retina processes color.
Wow.
Patients often report that everything suddenly takes on a slight blue or green tint, or that lights seem unusually bright and haloed, a condition known as photophobia.
That is wild. You take a pill to improve blood flow, and suddenly you are walking around seeing the world through a blue Instagram filter because the chemical accidentally bumped into an enzyme in your eyeball.
It is a strange quirk.
The profile does note that these visual side effects are usually mild and strictly temporary as the drug leaves the system. But, and this is a massive but, there is a critical line between a weird quirk and an absolute emergency.
Absolutely. The data is unequivocal on this warning.
While a slight blue tint is a known mild side effect, any sudden loss of vision in one or both eyes, or any sudden decrease or complete loss of hearing requires immediate, drop-everything emergency medical attention.
These are rare, but they are severe adverse events, specifically non-arteritic anterior ischemic optic neuropathy that have been associated with this class of drugs.
It is potentially due to severely restricted blood flow to the delicate optic or auditory nerves,
Causing permanent damage.
Okay, so we have the common physics-based side effects, the weird retinal quirks. But now we need to talk about the severe warning that is most universally associated with ED medications in the public consciousness.
The risk of priapism.
Right. Priapism is clinically defined as a prolonged, unwanted, and often excruciatingly painful erection that lasts for over 4 hours.
It is not a sign that the drug is working really well. It is a serious medical emergency.
If the blood rushes into the spongy tissue of the penis and gets trapped there, unable to exit through the veins, that trapped blood quickly becomes deoxygenated.
The tissue is literally suffocating. If it is not treated promptly in an emergency room, usually by draining the blood with a needle, priapism can cause permanent, irreversible necrosis of the tissue.
Leading to permanent erectile dysfunction.
Yes.
4 hours is the absolute cutoff before permanent tissue death begins. But what I found incredibly valuable in the iMedix data is that they don't just throw out the scary warning.
They provide the critical context for who is actually most at risk for this.
Exactly. It isn't just a random roll of the dice. There are specific underlying health conditions that drastically multiply this danger.
They specifically list blood disorders like sickle cell anemia, leukemia, and multiple myeloma.
This is where truly understanding the pathology is vital for patient safety. Let's take sickle cell anemia as the primary example.
In a healthy person, red blood cells are shaped like flexible, smooth, microscopic inner tubes. They easily bend and squeeze through the tiniest capillaries.
But in sickle cell disease, a genetic mutation causes the red blood cells to become rigid, sticky, and shaped like crescent moons or sickles.
Because of this abnormal, jagged shape, these cells can easily get stuck, interlock, and clump together,
Creating microscopic traffic jams that block blood flow, like trying to push a handful of jagged puzzle pieces through a small tube instead of smooth marbles.
Precisely. Now imagine introducing a powerful vasodilatory drug to a patient with sickle cell. The drug forces the arterial blood vessels to open wide, and a massive volume of blood rushes into the penile tissue.
But when the arousal fades and it is time for the blood to exit through the much narrower outflow veins,
Those abnormally shaped sickle cells can clump up at the exit. They create a physical, structural blockade. The forced, chemically induced vasodilation interacts disastrously with the physical, jagged properties of the disordered blood.
the blood is trapped, the pressure builds, and you have severe priapism.
Similar, though mechanically different, risks exist with leukemia and multiple myeloma due to how massive overproductions of white blood cells or abnormal proteins alter the viscosity and thickness of the blood.
That context is exactly why taking the time to do this deep dive is so important. It takes a warning label from a vague, scary possibility that people might ignore and turns it into a logical, understandable medical interaction.
It makes it real.
If you have sickle cell, you now understand why this pill is a massive risk. And along with the blood disorders, the profile issues a stark, non-negotiable reminder about cardiac risks.
Because of the systemic vasodilatory effects we've been talking about, anyone with a history of heart disease, irregular heartbeat, or stroke must exercise extreme caution.
If your cardiovascular system is already compromised or weakened, forcefully dropping your overall blood pressure with a PDE5 inhibitor can put an unbearable, potentially fatal strain on the heart as it struggles to compensate for the pressure drop.
Which leads us directly into what I would call the chemical minefield.
Let's get into it.
Because the dangers of Nizagara aren't just about the underlying health conditions you might have. They are heavily tied to what other chemicals, prescriptions, and even foods are in your body at the exact same time.
The interaction list is extensive, and some of these chemical combinations are absolutely deadly. Let's lay out the absolute contraindications. These are the combinations that are a hard, non-negotiable no. Do not pass go, do not collect $200.
Right.
The data states unequivocally that taking this drug with nitrates or illicit drugs that release nitric oxide, like amyl nitrite, often called poppers, is incredibly dangerous. They also put a massive red flag on alpha blockers.
The reason for these strict life-or-death contraindications all comes back to the risk of profound hypotension.
Hypotension is a massive, sudden, and life-threatening drop in blood pressure.
Let's look at nitrates first, as they're the most common culprit. Nitrates, like nitroglycerin, are commonly prescribed to older patients for angina.
Which is severe chest pain caused by reduced blood flow to the heart.
Nitrates work by directly releasing a massive flood of nitric oxide into the body to rapidly dilate blood vessels and relieve the strain on the heart muscle.
So the nitrate is dumping the green light signal into the body.
Exactly. It's flooding the system with a signal to open the vessels. Now, if a patient takes a nitrate, actively flooding their system with nitric oxide, and then takes sildenafil, which completely disables the enzyme that is supposed to eventually clean up that nitric oxide.
The result is catastrophic.
It is uncontrolled, compounding vasodilation. The blood vessels open far too wide, and they cannot constrict.
The systemic blood pressure plummets to dangerously low levels, and the patient can quickly go into cardiogenic shock.
The brain and the heart are simply no longer receiving enough blood flow to function, which can easily result in a massive heart attack or a stroke.
It is a fatal compounding effect. Two drugs trying to do the same thing from different angles, and the body just collapses under the lack of pressure. And the data notes a similar, highly dangerous risk with alpha blockers.
Alpha blockers are commonly used to treat everyday high blood pressure or to relax the muscles around an enlarged prostate.
Because they inherently lower blood pressure as their primary function, you cannot stack them with another potent blood pressure lowering medication without extreme medical supervision.
It's just too much pressure loss.
But beyond those broad classes of cardiovascular drugs, there is a highly specific and vital medical warning pulled straight from the text regarding an antiviral drug called ritonavir.
Yes, the ritonavir rule. This is a crucial piece of patient safety data. Ritonavir is a potent HIV protease inhibitor. It is a cornerstone of antiretroviral therapy for managing HIV.
The warning states that patients taking ritonavir must absolutely not exceed a maximum dose of 25 milligrams of Nizagara, and they can only take that small dose once within a strict 48-hour period.
That is a heavily restricted dosage constraint compared to the standard 100 milligram daily dose.
Why is the window so incredibly long and the dose so tiny for that specific drug combination? What is happening in the body?
It has everything to do with how the liver acts as a chemical processing plant. Both sildenafil and ritonavir are processed and broken down by the exact same specific enzymatic pathway in the liver.
Specifically, an enzyme called CYP3A4.
You can think of this enzyme as a very narrow, single-lane toll booth that clears chemicals out of the bloodstream. However, ritonavir is an incredibly strong inhibitor of that specific toll booth. It basically parks right in the lane and blocks it.
So it shuts down the liver's ability to process other things.
Exactly. When ritonavir is in the system, it essentially shuts down the liver's ability to break down and clear the sildenafil. As a result, the sildenafil cannot exit the body.
It just circulates back into the bloodstream,
Staying there for a much longer time, and its overall concentration in the blood increases dramatically.
A standard 100 milligram dose of sildenafil in a patient taking ritonavir wouldn't act like 100 milligrams.
It would act like a massive toxic overdose. It would lead to severe, prolonged side effects, agonizing headaches, and potentially dangerous drops in blood pressure.
Therefore, the dosage must be drastically reduced to a quarter of the standard size, and the frequency limited to every 2 days simply to prevent the drug from building up to toxic, unmanageable levels while waiting for the liver to clear it.
It is a literal chemical traffic jam in the liver.
And speaking of how the body processes things, the profile outlines some incredibly relatable practical advice regarding diet, because it's not just heavy-duty prescription drugs like nitrates or HIV meds that interact dangerously.
The things sitting in your kitchen right now can be dietary saboteurs.
Let's talk about breakfast. The data specifically warns against consuming grapefruit and grapefruit juice while taking this medication.
Grapefruit is a classic, widely known dietary saboteur for dozens of medications, and sildenafil is a prime example of why. It operates on a mechanism very similar to the ritonavir situation, though usually less severe.
Grapefruit juice contains specific compounds called phenocoumarins.
These compounds naturally inhibit that exact same CYP3A4 enzyme, but primarily in the intestinal tract rather than just the liver. This enzyme is responsible for the initial breakdown of the drug as it enters your system.
So if you drink a glass of grapefruit juice with your breakfast, you are knocking out the body's first line of defense against absorbing too much of the drug.
Precisely. If you consume grapefruit, you block that intestinal enzyme. When you then take the pill, far more of the active drug enters your bloodstream than the manufacturer ever intended.
And it stays there longer.
You are essentially giving yourself an accidental higher dose, significantly heightening the risk of those severe headaches, the painful flushing, and the dangerous low blood pressure.
So skipping the grapefruit juice is step 1. Step 2 involves the rest of your dinner. The data notes that high-fat meals can significantly delay the onset of the drug's effects.
This isn't a dangerous chemical interaction. This is a purely mechanical issue of human digestion. If you take the tablet immediately after eating a heavy, high-fat meal, say, a massive ribeye steak, a loaded baked potato, and a rich dessert,
your digestive system diverts massive amounts of energy and blood flow to the stomach to break down those complex, dense fats.
the tablet gets mixed into this slow-moving, heavy digestive sludge. Because the stomach is occupied with the fat, the absorption of the drug into the bloodstream is significantly delayed and blunted.
It just can't get through the traffic.
Right. It might take 2 or 3 hours instead of the standard 30 minutes to feel the effects, or the peak concentration in the blood might be blunted so severely that the drug appears ineffective.
Which is why the highly practical tip from the data is to take it on an empty stomach or after a very light meal for optimal, predictable results. You want it to have a clear path into the bloodstream.
And finally, under dietary and lifestyle factors, the profile states clearly and without exception that alcohol is unsafe.
Consuming alcohol while taking a PDE5 inhibitor increases dizziness and significantly lowers blood pressure.
Alcohol is a central nervous system depressant and a mild vasodilator itself, so combining it with a potent pharmaceutical vasodilator creates a dangerous compounding effect that can easily lead to fainting or worse.
And just as a brief note to round out the chemical processing discussion, the data highlights that patients with moderate to severe pre-existing liver or kidney issues need incredibly careful monitoring.
As we've discussed repeatedly, these organs are the body's primary filtration and waste management system. The liver breaks the drug down into metabolites, and the kidneys clear those metabolites out through urine.
If either organ is impaired by disease or chronic conditions, the drug will inevitably accumulate in the blood, necessitating a much lower dose or less frequent use to avoid toxicity.
Exactly.
So, we have covered the biology of the PDE5 pathway, the unique, heavily marketed vitamin formulation, the life-saving alternative uses for lungs and extremities, the severe medical risks, and the incredibly complex chemical interactions.
Now let's bring this down to the real world.
Let's look at the logistics of administration and, more importantly, how actual human beings, the patients, are interacting with this information. Physically, the data describes Nizagara as blue, oblong, or sometimes round tablets that are typically packaged in standard foil blister packs.
Looking at the logistical data, the standard dosage protocol outlined is 100 milligrams, taken orally as needed. It is meant to be taken ideally 30 minutes to 1 full hour before any anticipated sexual activity to allow for proper absorption.
The therapeutic window, the time during which the drug is actively inhibiting the enzyme, typically lasts up to 4 to 5 hours.
And as we stressed earlier, the maximum frequency is strictly, non-negotiably, once per 24-hour period.
Exceeding that one-a-day limit does absolutely nothing to increase the efficacy of the drug.
It only exponentially increases the toxicity, the strain on the liver, and the risk of severe side effects.
But what I find truly fascinating about this entire deep dive isn't just the dry medical data, the half-lives, and the enzyme pathways. It is the human element that platforms like iMedix capture.
This isn't just a static medical textbook. It's an active, living community of people searching for answers.
The data provides a brilliant snapshot of this community through their trending search tags and user reviews. If we look at the trending tags associated with this drug on the site, we see things like alternative therapies, healthcare costs, mental health, and erectile dysfunction.
These tags paint a very vivid, somewhat heartbreaking picture of the modern patient's concerns.
They aren't just looking for a magic pill. They are deeply worried about how to afford their health care. They are struggling with the immense mental toll of their physical conditions, and they are actively searching for alternative ways to manage their health outside the traditional system.
The anecdotal evidence provided in the text perfectly illustrates this complex patient mindset. On one hand, you have a user review from someone named Freddy Boy, who enthusiastically rates the drug as the best one.
It's a simple, satisfied review of the mechanics.
But then you look deeper into the community questions. You have a user named JustAGuy35 asking, ED issues at 35, really? And another user asking, what strategies help reduce anxiety naturally?
Those questions are so incredibly telling. They break my heart a little bit. You have the 35-year-old man grappling with a deeply personal condition that society constantly tells us only affects men in their late 60s or 70s.
He's confused, he's probably embarrassed, and he's turning to an internet forum for validation.
And alongside that, you have people desperately seeking natural anxiety reduction while simultaneously researching these heavy-duty pharmaceutical medications. It shows how deeply intertwined mental health, performance anxiety, and physical dysfunction really are.
This raises an important question regarding patient behavior and the harsh realities of the modern healthcare landscape.
What's that?
Why are younger men, like the 35-year-old user, seeking out these specific forums and actively exploring non-FDA-approved drugs like Nizagara in the first place? Why not just go to a doctor?
It directly ties back to those trending tags. Healthcare costs in many parts of the world, especially the U.S., are astronomical.
Traditional brand-name PDE5 inhibitors, the ones with the massive advertising budgets, can be incredibly expensive.
They are often prohibitively expensive for a younger patient who might not have comprehensive insurance coverage that includes lifestyle medications.
Right. If your insurance doesn't cover it, you might be looking at $20 or $30 for a single pill at a standard pharmacy.
Right.
That is completely unsustainable for most people.
Exactly. This immense financial pressure, combined with the desperate search for alternative therapies and the undeniable convenience and anonymity of the internet, actively drives patients toward non-FDA approved generics.
They are fundamentally looking for efficacy. They want a drug that works. But they are equally, if not more, driven by the need for affordability and accessibility.
And that very understandable, very human desperation leads them directly into the more complex, far less regulated, and potentially dangerous corners of the global pharmaceutical market.
Which brings us perfectly to the final and arguably most important section of our deep dive, the gray market.
We have to circle all the way back to the most critical categorization on the entire profile. Nizagara is clearly, boldly labeled not approved. It is a non-FDA approved generic.
And this is exactly where our conversation has to shift, from fascinating pharmacology to stark patient safety and the realities of global regulations. We need to be clear about what FDA approval actually means.
Okay, let's break that down.
When a drug is FDA approved, it means it has undergone years of rigorous, standardized, multi-phase clinical testing. It means the manufacturer has proven its safety and efficacy.
But more importantly for the consumer, it means the manufacturing process is strictly monitored.
Every single pill that comes off the line has the exact dosage it claims to have, and it is produced in a sterile, regularly inspected environment following good manufacturing practices.
When you purchase a non-FDA approved generic from an overseas pharmacy, you are entirely operating outside of that safety net.
The source material strongly emphasizes the warnings regarding this, specifically calling out the massive risks of the Wild West of online drug purchases.
They explicitly warn about the dangerous proliferation of fake or counterfeit Nizagara products circulating in unregulated online marketplaces. This is a massive, often under-discussed health risk.
You might read the profile and think you are buying a clever mix of sildenafil and B vitamins to optimize your health.
But in an unregulated market where anyone can set up a website, you have absolutely no idea what is actually pressed into that blue pill that arrives in your mailbox.
The reality of counterfeit pharmaceuticals is grim. A counterfeit pill might contain 0 active ingredients, essentially stealing your money.
Worse, it could contain the wrong dosage.
Perhaps triple the safe amount of sildenafil, putting you at immediate risk for a heart attack. Or, most terrifyingly, counterfeiters often use toxic fillers to bind the pills together.
Counterfeit drugs have been found to contain everything from simple talcum powder to drywall, heavy metals, and even lead paint.
That is horrifying.
And this is exactly why patient education platforms exist and why we are talking about this. The data includes a heavy disclaimer. The information provided on their site is for educational purposes only.
It is not a substitute for a doctor's diagnosis, a professional prescription, or common sense.
The platform stresses the absolute necessity of verifying the authenticity of any medication and consulting real healthcare providers before ingesting anything.
Given the incredibly complex chemical interactions we just spent the last 20 minutes discussing, the fatal risks with nitrates, the strict ritonavir rule, the blood disorder contraindications, taking a potentially counterfeit, completely unregulated pill purchased off a random website is akin to playing Russian roulette with your cardiovascular system.
The global context provided in the text adds another vital layer to this discussion. The profile notes that in certain regions, such as India, where Orachem Laboratories is based, Nizagara's availability might be much more prevalent and standardized.
This highlights how medical standards, patent laws, and manufacturing regulations vary wildly across the globe. What is considered a standard, easily accessible, culturally accepted medication in one country might be strictly unapproved, heavily restricted, or considered a gray market good in another.
But the internet has completely erased those geographical borders for the consumer. It allows a patient in a highly regulated, high-cost market like the United States to easily, with a few clicks, access drugs from a loosely regulated, lower-cost market halfway across the world.
And while that provides access, it completely shifts the massive burden of safety, chemical research, and quality control entirely onto the patient's shoulders.
And that is an incredibly heavy burden for the average person to carry. Navigating complex global drug markets, understanding intricate enzymatic chemical interactions, and separating legitimate alternative therapies from highly dangerous counterfeits requires a remarkably high degree of health literacy. literacy.
Most people simply do not have a degree in pharmacology. Platforms that provide these comprehensive profiles, complete with the scary warnings, the detailed interaction lists, and the spaces for community discourse, are attempting to bridge that massive literacy gap.
They are trying to arm the patient with the data they need to survive the gray market.
Exactly.
And that brings us to the end of this incredible journey. Let's recap what we've unpacked today, because the story of this single, seemingly simple blue pill is truly staggering when you look at all the angles.
We started deep inside the body with the complex biochemistry of PDE5 inhibition, the highway analogy, opening the lanes for blood flow by arresting the rogue enzymes.
We explored the brilliant, if controversial, surprise twist of the kitchen sink formulation, where the manufacturer blended a potent pharmaceutical with daily vitamins like B12, B6, and L-arginine to perfectly appeal to the psychology of the holistic men's wellness and biohacking market.
We ventured beyond the bedroom to discover how this exact same chemical mechanism saves lives by relieving dangerous pressure in the lungs for PAH patients and restores circulation in the extremities for those suffering from the agonizing cold of Raynaud's phenomenon.
We also carefully navigated the severe dangers, the predictable physics of the side effects, the weird visual quirks of the blue-tinted vision, the critical time-sensitive warnings regarding priapism, and the mechanical dangers of blood disorders like sickle cell anemia.
We walked through the deadly chemical minefield of mixing this drug with nitrates, alpha blockers, HIV medications, or even a simple glass of grapefruit juice.
And finally, we looked at the stark realities of the modern patient, driven by crippling healthcare costs and performance anxiety, to seek out non-FDA-approved generics in the potentially dangerous, highly unregulated gray market of internet pharmacies.
I want to remind you, the listener, why we take the time to do this. Whether you are actively navigating complex medication databases, trying to find an affordable solution for yourself, or you're trying to understand the massive tectonic shifts in global drug markets, or you're just trying to figure out how a simple dietary choice can fundamentally alter your internal biochemistry, your absolute best tool is, and always will be, critical thinking.
Don't just blindly read the claims on a glossy label or an internet forum. Strive to understand the cellular mechanisms behind them.
I want to leave you with a final thought to mull over, something that builds on the data we discussed today, but challenges how we view the future of medicine. If a non-FDA-approved generic drug can gain massive global popularity, bypass patient anxieties, and spark huge online communities simply by adding daily, over-the-counter vitamins to a standard pharmaceutical formulation, what does that tell us about the failure of modern traditional medicine to treat the whole patient rather than just treating isolated symptoms?
Are we rapidly moving toward a future where the lines between heavy-duty, regulated prescription drugs and aggressive daily wellness supplements are permanently blurred? And if that is the future we're walking into, who is ultimately responsible for keeping the patient safe in that massive, unregulated gray area?
That is a phenomenal, deeply complex question to end on.
Thank you so much for joining us for this deep dive into the fascinating profile of Nizagara. We hope you walk away from this feeling significantly more informed, endlessly more curious, and vastly better equipped to navigate the often overwhelming, noisy world of modern medical information. Keep questioning the world around you, keep learning, stay safe out there, and we will catch you next time.